On behalf of Region 7 and the Ask for Respect Supplemental Grant, we want to welcome you to our series of interviews focusing on the perils and pearls of lessons learned regarding COVID-19. Our hope is to share the lessons our colleagues have learned and to assist you with your healthcare journey during this pandemic. Thank you for listening.
Dr. Fadul, would you start by just sharing with us what you believe the key differences are between like Pfizer and Moderna, and then of course J&J vaccines?
Well, I think the key difference is the technology used to make these vaccines. So both Moderna and Pfizer are messenger RNA vaccine, which means you put a genetic recipe basically inside a shell, and that gets delivered to the cell to tell the cell how to manufacture the protein that ultimately is going to make the immune system react and store antibodies for future infection. So that's how the Pfizer-Moderna vaccine work. The Johnson & Johnson vaccine is a different technology where it doesn't use the same genetic code, but it uses kind of a fake virus that doesn't cause infection in humans to make the body react to it and make antibodies. So that's kind of the key difference. The Pfizer and Moderna are 2 shots. The Johnson & Johnson is 1 shot. And there are a lot of other nuances between the two, but these are the main differences in my opinion.
Great. Anything you'd add, Dr. Lawler?
No, there are differences in all of the vaccines, and I know people sometimes fixate on the efficacy numbers out of the clinical trials, but it's important to remember that all of those trials are done independently and they all use slightly different measures. And so it's not exactly comparing apples to apples to say, well, one is 95% effective and one is 94%. So obviously the 95% is better. You can't really directly compare those numbers, but what we do know is all 3 of those vaccines that are being used in the United States have excellent efficacy in the clinical trials, and at least early on in data from now tens and tens of millions of people who receive these vaccines, the efficacy data appears to be holding, and especially we now can definitively say that these vaccines do an excellent job in preventing severe infection and death.
Thank you. So let's talk about the hot topic, right? In the last few days, we've heard a lot about the Johnson & Johnson vaccine. We know CDC is doing their investigation. So what do we know for sure at this time? So Dr. Lawler, why don't you start with that, and then we'll have Dr. Fadul add to that.
Sure. So what we know is that a handful of people in the US have been diagnosed with a very unusual syndrome that consists of blood clots occurring in unusual places in the veins around the brain and in the veins in the abdomen in association with low platelet count. And this is an unusual cluster of phenomenon to occur in people who have no underlying conditions. So it is concerning that potentially it could be related to the actual vaccine. And we know that it looks similar to many cases that have been seen in Europe with the AstraZeneca vaccine. And both the AstraZeneca vaccine and the J&J vaccines are adenovirus vectored vaccines, as Dr. Fadul pointed out. And so that commonality in the fact that both have been associated now with this unusual syndrome has given regulatory authorities and public health experts a reason to take a pause. I think it's important for people to remember that so far this syndrome appears to be incredibly rare. So far, fewer than 1 in a million based on the data we have in the US. But it still is concerning, and I think it's appropriate to take a pause. But again, I think it's important to keep in mind that while your risk of having a severe complication from this vaccine so far appears to be about 1 in a million, and so far the risk of death is 1 in 7 million, important to keep that in the context that during the COVID-19 pandemic, 1 in 800 Americans has died of COVID. So we're talking about a risk that is more than 1,000 times smaller than the risk of dying of COVID, coming up with one of these potential blood clot complications. So I think that, in my opinion, the CDC and the FDA have done the right thing in taking a pause and looking to see if there are specific risk factors that are associated with this syndrome. But ultimately, I think the balance of risk benefit still weighs very heavily on the side of vaccinating folks.
So Dr. Fadul, would you add anything to that? And then I think about too, you know, as we're in this race against time, right, with all the variants starting to occur, what do you think the implications of this are, and what else would you add to what Dr. Lawler said?
Yeah, I mean, I totally agree with Dr. Lawler that these are extremely rare events, as he pointed out. However, they're unusual. So therefore, we kind of have to think about what's happening here. But the pause does not mean it's complete stop or suspension of these vaccines. So people have to understand that. The other thing that I would add for people who have received the Johnson & Johnson vaccine, there is really no reason to panic. Yes, you should monitor yourself. You should think about if you have unusual abdominal pain or, you know, headache or any other concerning symptoms, you want to talk to your doctor immediately. But I don't think at this point there is enough evidence to suggest there is clearly a direct cause or link. And at the same time, these are extremely rare. So I just want to reassure people that if you had received the vaccine, you're still getting the benefit of not dying from COVID and not having a severe illness.
Great, thank you. And so as we're in this period of time with really navigating through now this new event that's occurred that put the pause with J&J, you know, we had vaccine hesitancy before. What would you say to everyone as we're out there, healthcare workers, the public, what would you say to them right now as we're navigating through all this?
Well, I think
Your vaccine, but you know.
Yeah, it's really unfortunate because, you know, the WHO director stated this very well, is that our biggest challenge right now is not so much the virus itself, but all the misinformation that circulates out there related to the virus and to vaccine. So this has been a daily fight for many of us in the healthcare field to try to educate and give people the right information. And unfortunately, what happened now is the two vaccines, AstraZeneca and Johnson & Johnson, is creating this fertile ground for myth and misinformation to spread even more. And I want to reassure people is that they need to trust science, because science is also what discovered that these issues happened, and science is what's investigating them, and science is what got us to this point that we now are talking about preventing death from a disease that was highly, highly deadly. So we need to put our confidence in that it's going to get us through this. It's going to answer the questions about the Johnson & Johnson and AstraZeneca vaccine. But please don't trust the information you find on social media or, you know, your neighborhood friends without double checking that information. And please do not spread it further, because if it's misinformation, it's going to affect people and it might lead to somebody dying from a preventable illness at this point.
And Shelley, I would add that the recent events with J&J, to me, really point out the fact that our safety systems are working. If you think about it, we often use the term 1 in a million shot as something, you know, something that's just incredibly rare and impossible to predict. But we're picking up 1 in a million phenomenon right now with these blood clots, and that should reassure people that the safety systems are working incredibly well. We're picking up safety events that could not have possibly been predicted or detected in even huge clinical trials with tens of thousands of people. And so the fact that we're picking these up and that we're evaluating the data, to me, gives me great confidence that the safety systems that we have in place to make sure that vaccines and all medical products are safe are working the way they're supposed to. And I think that should give people more confidence in the safety of these products and the fact that corners were not cut in bringing these to bear.
Great points from both of you. Thank you. The next thing I want to touch on is variants. So what do we know about the current vaccines that are available and how effective they are against some of these variants that we're hearing about?
So the issue of new variants that are now popping up in many places across the globe, and certainly are critically affecting case counts around the world and in the US, that concern is real. So we know now that in the United States, probably a significant majority of the viruses we're seeing now, a significant majority of the cases of COVID-19 are due to the B117 UK variant. And that virus is more transmissible, it's easier to pass from person to person, and it causes more significant disease, particularly in young people. And we're seeing the effects of that already. To me, what's even more concerning are some of the other variants that are circulating, including the South African variant and the Brazilian variant known as P1. And that P1 variant is causing large outbreaks now in Canada and has already started to spread within the United States. And its rate of growth is even faster than what we saw the rate of growth for B117 or the UK variant. And it's true that we're concerned about how some of these variants may have some ability to escape immunity from vaccine. Now, I think it's true that the data we have so far indicate that our vaccines will be effective in preventing disease, but not quite as effective as they were against the wild type virus. And so what we really need to be concerned about is continuing to take actions that suppress transmission in the community, which obviously includes vaccinating as many people as we can. And so people should go get the vaccine when they're eligible. But it also means continuing to do the non-pharmaceutical interventions of wearing face masks and avoiding crowds, avoiding indoor confined spaces, particularly where you're together with people unmasked. All of those things that we know worked to reduce case counts, we still need to do those, because the big issue is the more cases we have in the community, the more times we allow the virus to spin the roulette wheel, the more chances it will have to come up lucky and get a combination of mutations that make a more transmissible and a more lethal virus. And we're very close in the US to getting to widespread immunity with vaccines. We're only a couple of months away. And so we really need to focus emphasis on doing that. And then worldwide, we really need to focus on rolling out more vaccines, particularly to vulnerable countries, many of which are experiencing large outbreaks now. And again, increases the risk for everybody on the planet that new variants will continue to emerge.
That's so important. The speed of travel today is so different than ever before. So, Dr. Fadul, anything you'd like to add about the variants? And then I want to hit you up about what your thoughts are on what we're seeing with some of the vaccine breakthroughs and some of the clinical considerations, symptoms, illness, things like that.
Yeah, so I think, like Dr. Lawler beautifully stated, is that the issue with the variants is that if we let this continue, if we let the transmission continue, that's going to lead to more mutations in these viruses. They're known to like to mutate and change, and they could do that very rapidly. And that might eventually affect vaccines and might eventually even affect some of the therapies we have. So it's very important that we put a stop to that, because we don't want to lose all the gains we've made. We've made so much gains. We're getting there to the end of the tunnel. We could see the light at the end of the tunnel, and letting this go out of hand at this point is going to be a critical step back if we do that. So in terms of the vaccine breakthroughs, I mean, it's not something that was unexpected, because when you talk about 95% efficacy, this is probably one of the best things that we ever had in medicine, is to have a vaccine to be that effective. But what that really means is that it was patients who actually had symptoms. It was not so much the asymptomatic patients that we all know exist. So we were able to detect the ones who came to us during these vaccine trials and said, I have symptoms, and then we tested them, and that's how we came up with 95% efficacy. But the most important thing is not so much the prevention of symptoms or prevention of even asymptomatic transmission, although those are critically important. We think the vaccine actually has a role in that. But the fact that the vaccine prevents people from dying from COVID, from hospitalization, from severe illness, that's really where the money is, because we all have lost people close to us from COVID-19, and we want to put a halt to that. Eventually, we're going to get to the point where we're going to be able to prevent transmission, and we're going to prevent symptomatic COVID cases. But right now, if we just put a halt to the losses that we've seen with COVID, I think that's going to be critical.
Great, thank you. Yeah, we have to keep remembering, right? There's no vaccine that's 100%. So you're right. We're going to continue to see that happen. In fact, the annual influenza vaccine is a great example of that. So let's talk also about what we're hearing, even today on the media, hearing about Pfizer saying, oh gosh, we're going to probably need to have a booster in a year. Of course, we know that all of that is evidence-based as well. So what are your thoughts about that, Dr. Lawler?
Well, it's a little too early to tell, I think, about boosters. Certainly, I think most experts have felt since the very outset of early trials of these vaccines that it was likely that boosters were going to be necessary at some point. And I still think that's the case, just based on what we know about all other coronaviruses. Immunity to those viruses tends to wane over time. And so even with these amazing vaccines, as Dr. Fadul pointed out, we're probably going to have immunity that eventually starts to taper over time. Now, whether that need for a booster is going to occur at a year or 2 years, it's still difficult to tell. One of the problems that we struggle with currently is as opposed to many other vaccines and diseases that have been around for decades or hundreds of years, and we've studied them for a long time, and we know how to predict how things like antibody levels correlate with immunity. We don't have enough information right now with this virus to know that if you have an antibody level that's here, that means that you're protected, right? And so it makes it very difficult for us to understand how long immunity is going to last and how effective it's going to be. The only way that we really know that is by waiting until people get to a year and seeing how many people who got the vaccine a year ago are getting infection. And if those rates are starting to go up, then obviously that's going to be a time for a vaccine. So all of this is really still guesswork. I think it's almost certain that we're going to need booster shots. I think a year is maybe a conservative prediction. I think there's a good chance that we may be able to go out a bit longer, but again, we really won't know until we are able to do the studies that tell us that answer.
Yeah. We've heard a lot, and we continue to wrestle with how to improve access to care, improve access to vaccine in our disparate populations. Do either of you have any thoughts on that topic or best practices that you've heard of in order to get the word out, to make sure that we're reaching these populations that we need to get to in order to give them what they need? Number one, but number two, to really help with the overall vaccination strategy.
Yeah, I think the most important point to remember about COVID-19, it's a pandemic. It's one of those equalizers, and if we don't address it everywhere and with everyone and every population, every race and ethnicity and background and nationality, we're not really going to make a win against this virus. So while we're making it very accessible to people who already had access to healthcare, which is great, we really need to think about those people who are at the edge of the system, who haven't been able to access healthcare for whatever reason that is. and we need to take the vaccine to where they're at with the right information as well. So we shouldn't be sitting waiting for them to show up or use excuses such as healthcare system mistrust or whatever to not give them the access that they need for vaccine. We need to take a deliberate action to change that narrative. And then unless we do that, I don't really see a way out of this pandemic, because you have to get to that herd immunity level, and you have to get to it actually globally in order for you to make a win. Because if the virus is circulating in an underdeveloped country and mutating there, eventually that mutation is going to come here to this country, and it's going to make us give us a setback. So equity, addressing health disparities is critical during this pandemic. And I'm really hoping that the lessons we learn during this pandemic of how fragile and inequitable health access is in the country, that led to some population faring really poorly compared to others, do not stop at the end of the pandemic. Because if anything, this told us is that if we had addressed these issues 100 years ago, we wouldn't be dealing with them today. So I'm really hoping that the lessons learned from this pandemic continue and apply to other diseases as well, because this is not only about COVID-19. This is about a lot of other health care issues and systemic issues and structural racism that we need to address.
I think that was just eloquently put, and you're right. There are a lot of really bad things about COVID, but there are a lot of things that we do hope for that we can hold on to once this is done, that we've learned about and can do better. A question for you both as we sort of finish up today. Is there anything I didn't ask you about vaccine and any other just kind of nuanced things or nuggets of information that you think our audience would be eager to hear about or better understand that we haven't talked about? Dr. Lawler, I'll start with you.
Well, I think just one thing that I would re-emphasize, and that is that we already know how to defeat this virus. We already know the interventions that have worked in communities and countries across the world. And they are those non-pharmaceutical interventions that prevent transmission within the community. Unfortunately, they're not necessarily always fun, and people don't want to talk about them. Politicians absolutely don't want to talk about them. And people have obviously, had a long year plus of dealing with the pandemic and just want to put it behind them. But we can't do that if we want to get out of this in the best position we can, with the fewest lives lost and the least economic damage. And that means for the next few months, again, wearing face masks in public, avoiding crowds, avoiding indoor confined spaces, especially where people aren't masked. That means not doing indoor dining, not going to bars, not going to parties. If we can do those things, like many countries around the world have been able to do, unfortunately, not a lot of countries in Europe or in the Americas, sadly. But if we do that, we can get through to the summer when we're going to have a significant portion of people vaccinated. And then obviously we need to take care of those issues of vaccinating as many people as we can, but we have to keep doing those non-pharmaceutical interventions. I know it's not a fun thing to consider. I would love to be going to indoor restaurants with my family right now, but it is just not responsible. We've lost over 550,000 Americans, and we should not lose any more.
Dr. Fadul, any final comments?
Yeah, so I mean, I would agree with Dr. Lawler's comments. It's in our hands, and it's a collective social responsibility that we need to halt the spread of this disease. And I think all of us need to think about using our privilege to help others and advocate for others to have access to vaccine and to do the right thing as well. And I think it's doable. I mean, other countries have proven that this is doable, and there is no reason that the richest, most advanced country in the world can't do it. So it's in our hands.
Thank you both very much for your time and for all you do for the patients and the public and communities that we serve. So thank you very much.
Thank you, Shelley.
Thank you.